All right, it's about that time. I went ahead and pushed the record button. We will obviously have these to look back on, and that way we can remember all the keywords that Darcy helps to teach us this morning. Really excited for all of you to be jumping on here. Darcy, there will probably be some people trickling on this morning. I know there were some other meetings that people were attending. And with that, I'm just really grateful that we get to have this opportunity. This kind of came out of an opportunity or a conversation where a lot of us were brought together a small committee from different various opportunities where we are learning how to navigate different situations. And this then came out, Ms. Samantha Lawman, our animal science specialist, recommended Ms. Darcy Cole to reach out to her as one of the experts in this field to really help give us an opportunity of education and awareness, and then spark some really good conversation, and obviously serve as a line of answering questions as well. So we're really excited to have this different series. It's kind of a neat opportunity where we'll start out here January 8th, and then February 2nd, we have Making Simple Accommodations. March 11th, we'll talk about this really neat accommodations kit that Darcy has developed and put together with us. I will get those delivered out in the spring when we go to spring training over in Medora. And so we'll have, March 11th will be her going through that kit. We'll actually get to hand those out to be situated across the state at spring training. And then March 8th, we talk about positive behavior and intervention strategies. And then kind of culminating will be April 10th in Medora. And we definitely will still have a Zoom link. So in case you aren't coming to Medora for spring 4-H training, we'll make sure that we have some really neat scenario-based conversations and opportunities for everyone to ask questions and just gain some really cool knowledge and help Darcy learn about us, and we can learn from her. So with that, I'm going to go ahead and pass this over to Miss Darcy Cole. She's an incredible individual. It's been so fun working with her so far. And go ahead and take it away.
All right. Well, good morning, and everyone. Thank you for joining me at 9 o'clock on a Monday morning. I know that's probably not your ideal time to be hopping out of training, but I appreciate you being here. As Leanne mentioned, I'm going to be doing this series, and today is really about just kind of setting the groundwork for things, helping you to understand the basics of what disability is, and then we'll kind of step up each one of the sessions, our understanding around that. My name is Darcy Cole, and I am a 4-H program operations educator. I work regionally for the University of Minnesota Extension, and I support kind of like the southern half of Minnesota, and program operations is my main piece. So that's all of the things people love about their job. So contracts and agreements, finances, risk management, all of those type of things is what I do as the majority of my time. But I'm also fortunate to be able to have some of my time to be able to spend on working with young people with disabilities and helping to create those inclusive environments, which for me is an area I'm very passionate about, both personally and professionally. And you might hear some pieces come out through the series that we're doing. But I remember as I started my career, which I've worked for Minnesota 4-H for almost 18 years now. I remember having those youth in our programs that maybe we're kind of off on the sidelines, maybe not always actively engaging in the activities we were trying to teach them, but yet not always understanding why that was. And then personally, I bring kind of that experience as a mom to 4 kids. My oldest 2 do both have autism. So you'll probably hear me speak a little bit about that, but very different kind of ends of what we call the spectrum with that. My oldest is 14. She has a lot of support needs. She's nonverbal, all of that kind of things that go with that. And then my son is 11, and he needs a lot less support. He struggles more with the social anxiety, some of the fine motor pieces, and then just some of those kind of more milder symptoms of what we might call autism. So you'll probably hear me reference some of those things too from both the professional and the parent perspective as we jump into this. So with that, objectives for today, I want you to understand why working with audiences with disabilities matters, because it is important work, but it sometimes is work that maybe it's a little bit overlooked when we think about our roles with 4-H. We're going to learn about kind of the basics of disabilities. We'll go through some grounding information, that type of stuff, so that we're all talking about and thinking about disability work from the same perspective. And then finally, I will share with you and we'll explore some best practices to help us create inclusive environments for youth of all abilities in our 4-H programming. So we think about, why does this work matter? I wanted to share with you a little bit of statistics from your state so that you can see where kind of your demographics might be with the program that you are leading. Across the state of North Dakota, 11% of residents do have a disability, and that is all ages of residents. And then we look at those school-age kids, those kids that might be in our 4-H programs. 14% of our public school students are receiving special education services. And we want our programs to be in parity, or to have the demographics of our program reflect the actual demographics of our communities. So that means that in theory, 14% of our 4-H members may also have some sort of special need or disability. So just keep that in mind as we're doing that. And you can see the chart on the slide there also includes the percentage of people by county that do have disability. And that is 2019, but I wasn't able to find any more current demographics in that online. So if you pinpoint your specific area, you'll be able to see that some of you might be a little bit lower, or some of you might be a little bit higher than those statistics that I just shared. And knowing that we have 11% of our residents with disability and 14% of those school-age kids in public schools. That means that all of us do in our programs have young people with disabilities, whether or not we realize it. And again, some of our families will choose to disclose to us their disabilities. They might share that through their 4-H enrollment information or just conversations we have. But we also know there are many people that have what we might call an invisible disability. And we have no idea that they have a disability unless they choose to disclose this to us. So just know that as well as you're thinking about your individual program. All right, so want us also to kind of think about really starting this work. We know that it can be intimidating because we don't want to say or do the wrong thing, but it is really important that we just start, right? So that might mean making some very small changes, and you might learn about some things through this series that you can do in your program that don't really make you vulnerable, or might not take a lot of energy or effort or money to make changes in your program. And those are great, right? If you are on kind of that newer learning part of to think about disability work. For others of you who might have more experience with this might mean making some bigger changes in your programming to really help young people to have a more inclusive environment. But just know that you might say the wrong thing or do the wrong thing sometimes, and that's okay. Apologize, try to learn and try to do better. As you're doing that, most people are just going to be really happy that you actually care enough to try doing things. So just know, jump in, right? Even if you're a little bit nervous about that, because even I make mistakes as we're doing this work, just because things are constantly changing. Each individual is unique. So I encourage you just to take in the series, make whatever changes you feel are best in your program, but do something to make our environments more inclusive for young people with disabilities. All right, so as I mentioned, we'll start with some grounding information so that we're all kind of approaching this and speaking about this kind of from the same perspective. So it's important to recognize that diversity does include disability. We might not sometimes think of it right away as being diversity, sometimes because it's not as visible as some of the other diversity. Some of the other reasons are we don't always measure it in the same way. I'm not sure what your enrollment data looks like that you collect, but here in Minnesota, we don't really collect statistics. I don't think most states do in their 4-H programs around young people that have a disability. However, we collect here in Minnesota demographics around socioeconomic status, if families choose to share that when they enroll, that race data, those education backgrounds of parents. We collect a lot of those type of information, and we think about that as diversity, but sometimes we overlook disability as being part of that because we're not collecting information that helps us to identify that. When we're thinking about disability, we'll use the dictionary definition that you see there in that second bullet, which is really that it's any various difficulty. It could be something physical, emotional, behavioral, or learning related that causes someone to need some additional supports, services, accommodations to be successful in programming. So that's what we're going to consider to be a disability from our perspective. And we also, as I mentioned earlier, people can have disabilities that we can see. There's some physical things that we can very much see. If someone is a wheelchair user, we can tell that they have a disability. But if someone has a learning disability or they have a mental health related disability, we may not be able to see that or even recognize it at all without someone actually telling us that. And then the final piece that we need to keep in mind as we're thinking about this disability work is we want to always presume competence. So we want to assume that a young person or a volunteer that might have a disability in our program that we're working with is able and capable to do things on their own until they tell us otherwise. And the reason that is so important is we want all of us, right, to be able to be self-sufficient, to be able to do things for ourselves. And we don't necessarily like it when someone steps in and assumes that we aren't able to do something. The same is true of someone with a disability. However, their experience of having people step in and assume they can't do something is often many times heightened from what other people might experience. So it's really important that we're just allowing them to do what they can until they tell us that they need help, and not just assuming that someone can't do something because they may have a disability. When we're looking at how we want to approach our programming as well, it's important to recognize that inclusion is really the goal, but there's some pieces that may look and feel like inclusion, but aren't always necessarily true inclusion. So I want to look at kind of thinking about exclusion, separation, integration, and inclusion, and how those really look for a person with a disability. And this also can relate to any other type of diversity that someone might have as well. Exclusion, that's probably one of the easiest ones of these to understand. So exclusion really is about starting with the idea that there are normal people, and then there are people that are not normal. And consequently, because we're making those assumptions, it automatically leaves some people out that might not consider themselves normal, or that we might not consider quote unquote normal as a society. And from that perspective, really terms like disability, disabled, handicapped, invalid, all of those words are really just implying that someone with a disability is less than or inferior to someone else that does not have a disability. And then we look at separation, or you might consider that to be like segregation. You can kind of see from that image that you have, this group in green, and then you have these outsiders that are kind of in their own little group. And that is really about having separate or segregated experiences for someone that has a disability, and it excludes them. And again, this can relate to any other type of diversity as well. So it could be women, people of color, whatever it might be, but having them not be part of the main group because of their differences that they have. Then we have integration, which with that, we have this idea of normality, or what the group dynamics already look like. And it's about really not necessarily making a ton of changes or accommodations or adaptations to what we're doing, but rather just trying to fit those people who might have a disability into what we're already doing, without really setting them up for success by doing anything different for them. And again, doing what we might consider quote unquote normal. And this is the only place that you're going to hear me use that language, but it's language that really kind of grounds itself in dividing or separating someone who has a disability and someone who doesn't have a disability. And then we look at inclusion, and inclusion is really our goal. That's what we want. We want, and that's really taking it one step further than that integration, and having those people be a part of what we're doing, but also making accommodations, changes, adapting our programs so that everyone can find success, and being flexible in what we're doing so that what we might have considered to be our normal way of programming looks different, because we're actually asking those people with disabilities, what do you need to be successful? And then making those changes. And you're going to find, and we'll talk a lot about this in the next session, that when we make accommodations or changes in our programming, they generally might be targeting one or two individuals maybe that ask for that accommodation. However, they are going to benefit the whole group. So when we think about inclusion, everyone in that group is benefiting from the changes that we're making to our program and from having those young people with a disability in the space. So that's another kind of piece to think about is how are we actually incorporating or including people with disabilities in our programming? Is it, like I said, having that exclusion where, we're just not even having them a part of it? Is it that separation where, we have our program and then we have these people with disability kind of on the outside doing their own thing? Is it integration where, we're having them be a part of the program, but we're not making any adaptations? We're not doing anything to really help them be successful? Or is it truly inclusion? Are we accommodating our programs to make sure that everyone present is going to be successful? So keep that in mind too, as we're thinking about how you're approaching your 4-H programming. And I also want to say that wherever you are in this kind of continuum of what inclusion can look like is okay. As I mentioned earlier, we're all starting someplace. Some of us might be starting with, very little experience and this is new work to them, and other people might be having a ton of experience. So what they do may look very different, and that's okay. But the important part is to work our way to eventually get to that inclusion. All right, then I want to talk through a quick overview of just what disability is. And it's important when we think about that is to remember that every person's unique. So that means that every disability is also unique. So the way that one person presents their disability, even though they may have the exact same category or type of disability, someone else may look very different. So for example, I shared a little bit about my kids earlier. So I have two that have autism. So if you saw like their IEP or we're filling out something and we're putting about their disability, it's going to say autism, right? But their autism is very different. Like I said, my 14-year-old, she's nonverbal. She needs a ton of support. Like cognitively, she is definitely not at 14 by any means. And like I said, she just needs somebody one-on-one with her all of the time. My 11-year-old, he again also has autism, but is definitely at a very different part of the spectrum. When we look at that, he is able to be with his peers all day at school, and has a shared para versus that one-on-one person and spending that whole day in a special education room. And like I said, for him, fine motor is difficult. Social pieces are difficult. And having kind of that back and forth conversation is really difficult. So again, even though they both have autism, it's very different autism. And I just want to preface that as we kind of talk through all of this, that people are going to be very different in what their disability might look like for them individually. Also, when we look at types of disabilities, we're going to talk about it in ways that are permanent disabilities, but also temporary disabilities. And I don't want to equate that they're the same or equal, because a permanent disability is something that someone is going to have that's a part of their life, their whole life long, or from the time that they develop that disability on. However, there are times that all of us, whether or not we have a disability, we will have a time that temporarily we will probably need some sort of accommodations at one point or another because of an injury, sickness, whatever that might look like. So just know that too. Our first category is intellectual disabilities. So those are things like Down syndrome, right? That's a permanent intellectual disability. A temporary disability might be a concussion. So it might be someone that, they fall, they hurt themselves, they have that concussion, and that might affect their intellectual capabilities temporarily for that time while they have that. And while we're doing this too, I would love for you to put in the chat any other examples of intellectual disabilities that you might be aware of, so that we can kind of share with each other a little bit around some of maybe the experiences we've had, things like that. There's a great question in the chat. Are medical conditions also considered a disability? So like diabetes or asthma? Absolutely they are. Yes, they absolutely are. They're a piece that are going to affect someone's life every day and that they need to live with, and may also need some accommodations as we're thinking about that. The same is true even for like a food allergy, right? There are pieces that someone needs to be aware of, plan for, all of that throughout the course of their life. So yes, definitely those medical pieces are definitely considered a disability. Then we'll look at physical disabilities. So those are things like being a wheelchair user, right? That's a physical disability. Those physical disabilities are the ones that we can tend to see and identify a lot easier versus more of those invisible type of disabilities. And an example of a temporary one might be that you break your arm or you break your leg or whatever that might look like. And you might need temporarily some sort of accommodation. So, when you think about kids in school, I remember seeing a lot of when I was in school, right? Somebody who's on crutches because they had knee surgery or whatever it might be. You may need some accommodations in someone helping you carry your things, right? Someone being there to help open doors, those type of pieces. So just keep those in mind too. And again, if you want to throw in the chat any examples of physical disabilities that you maybe have some experience with, that would be great. Our third category are sensory disabilities. So autism spectrum falls into that, sensory processing disorder, things like that. Also, migraines can be a temporary sensory disability. I know personally, I get migraines, luckily not very often. But when I do that, like my sensory capability is very much affected. My vision is off. There's places where I can't see at all, like it's like blind spots, those type of things. So just know that when we think about those sensory disabilities, we need to keep in mind that like 90% of what we take in and how we process the world comes through those sensory systems that we have. So the sight, the hearing, the touch, the smell, the taste, all of those type of things, so that they can have a really great impact on how we interact with our environment and those around us. And then our final category is mental health disabilities. So those are things like bipolar disorder, depression, anxiety. You can see those things listed on there. And when we think about those, it's also important to recognize that this is a category that people might not often think of as a disability, but it definitely has an impact on a person's daily life. When we think about mental health disabilities, it's also important to recognize that they might be permanent, they might be temporary, or they might just come and go. Like you might have days that you are having mental health struggles and other days that you're not, right? So, or they might be a series of time in the year where it's harder, and then other times it's less hard. So, so just know that, like I said, they can kind of come and go as well in this type of category. So you want to throw in the chat any other examples of any of these 4 categories that you might be aware of, that would be wonderful. And we'll keep kind of plugging through so that we get through this basic content for you today. All right, then I wanted to share with you a little about some best practices for creating inclusive environments for youth with disabilities. And I would also preface this in saying that this all would apply to volunteers or adults that you have, parents, whatever it might be in your program as well. When we're doing that, we want to make sure that we're being proactive. Sometimes, all of us work on the fly and we're having to just kind of plan something last minute, go and do it, right? But we really want to, especially when we're working with young people with disabilities, is really think ahead of time, be proactive about thinking about what type of things may happen in your program, thinking about the environments that you're in, and we'll talk more about that when we talk about our accommodations, but thinking about like, is the physical environment going to be supportive and accommodating for everyone, regardless of what their ability may be. We also want to make sure that, when we're talking about being proactive, that means making sure that our staff, our youth leaders, camp counselors, interns, whatever those people might be that are working with our programs, that they are trained and hopefully fairly comfortable in interacting with young people with disabilities in our program. So keep that in mind as well when we're thinking about being proactive. It also means being flexible. So we have our plan or our lesson plan of what we are going to do, maybe at an after-school program, a day camp, whatever that might look like, or even our plan for County Fair Judging Day, how that's going to look. But we need to also be flexible, and we always want to be flexible, but it's especially important with this audience because we know that what we think someone's going to actively engage with or be successful with may not always happen in that way. So we might need to change things on the fly. And that also might mean that we need to have conversations with that young person if they're able to advocate for themselves and communicate their needs, to ask them how we can adapt that program or that situation to help them be more successful. We also need to make sure we're having a plan and a backup plan. So that means planning out what we're going to do, how things are going to look when we are there, but also having a backup plan of what are we going to do if X, Y, Z happens, right? So if there's some behavior things, how are we going to handle that? If a young person isn't engaging in the activity in the way that we thought, how are we going to shift gears or try and engage that person? We probably have, when we're teaching a day camp or an after school program, we probably have like a backup activity just in case we get through things faster than we thought we might need to. It's important to think about having those extra activities, but also think about how we're actually going to respond if certain situations come up. And we'll talk about that really we talk about that positive behavior intervention session, and then also in that scenario session, we'll talk a little bit about what can you do when things happen. Another important best practice is to make accommodations as they're requested. So that means making those adaptations to programs so that we can help people be successful, but it also means making sure that people know that we want them in our program, that they feel welcome, and that we want to make accommodations. And so that means, like, here in Minnesota, we have an accommodation statement that staff are asked to include on their registration materials, promotional flyers, those type of things for activities, so that people understand that we want them in our program. We want to make accommodations for them. The same is true, as staff are leading up to county fair, state fair. We have systems put in place so that families can share with us what type of accommodations they need for their young person to be successful. And we'll talk more about how to kind of put that in practice if you haven't been using some of those ways of letting families know that we want them in our program and want to make accommodations for them. Another really important best practice is that we're establishing relationships. We know that relationships are really important to all young people, all parents, all families, all volunteers in our program. But again, it's especially important with people with disabilities. And the reason for that is the more comfortable they are with us, the better relationships they have, the more open and honest they're going to be in communication. So that means that if their young person or them themselves have a need, they're going to share that with us more likely if we have that relationship developed. Having those positive relationships also make it a lot easier when you have to have a tough conversation with a family. So if you have to reach out to someone and say, your child was at camp and things didn't go well, right? It's a lot easier to have that conversation if you have a pre-established relationship than it is to just randomly cold call someone and say, things weren't good at camp, right? So make sure that you're establishing those relationships. And in doing that, like I said, those families will share with you more so that you can know what to do to help support their young person. We also want to be positive. So oftentimes or sometimes it can be really easy to see the things that might be a challenge or a struggle for someone. But we want to really be working, as we're thinking about people with disabilities, at looking at what they're good at. So looking at what the positives are, and those positives may look and be to a different extent than maybe other young people in our program. But we still want to make sure we're recognizing those successes and finding ways for us to utilize and capitalize on those strengths. So if you have a program, for example, where you're doing something with engineering and you're looking at how to build bridges, if you have a young person who has a lot of interest in that, maybe a really narrowed focus interest on that or an obsession about that, think about how can you positively use that in your program. So if this young person maybe isn't super engaged with what you're doing sometimes, maybe they could help to teach parts of that lesson activity, or they could share a little bit about some of the facts or knowledge that they know about bridges. So just think about what are those ways that we can be positive in utilizing the strengths of the young people and also helping those around them to see what they're really good at. And then another best practice is really about making sure that we're keeping things simple. So using simple language, giving one-step directions at a time. It can be really easy for us to rattle off 5 directions of we're going to do this, then this, then this, then this, and this. Now go do. But it's really important when we're working with people with disabilities to just give one step at a time have them complete it, give another step. And again, all young people in the room are going to benefit from us simplifying things. So just make sure that you're approaching that in that type of way. It's just keeping language simple, keeping your activities simple, doing one step at a time, just not to overcomplicate things. And when I talk about simple language, what I mean by that is, not using complicated terms. Also, people that have social challenges might not understand language that isn't really clear. So if you're talking about it's raining cats and dogs, that may really confuse them because they may literally think that it is raining cats and dogs. So we want to be keeping those language pieces really simple, just because not everyone is going to understand some of those social nuances and some of the things that we might say that aren't clear black and white type of language. Okay, before I go into etiquette, I just want to see if there are any questions so far, because we've kind of wrapped up the really big pieces about like, here's the background and kind of the basic information about disability. And you can put in the chat, you can unmute, whatever you're comfortable with for any questions you might have. Okay, I take it there are no questions. I'm not hearing or seeing anyone asking anything. So another important piece as we talk about disability work is we want to think about etiquette. So how are we interacting with people? How are we speaking to them? How are we approaching our interaction with them? So I'm going to give you some basic etiquette, and then we're going to talk a little bit about etiquette as it relates to specific types of disabilities, because there is a little bit of etiquette that may look different depending upon what their disability looks like. So some basic etiquette, and I will share all of this with you after our session. I have a kind of like a etiquette tip sheet that I'll share with you. I'll also share with you some of the other resources that we're going to talk through after this today too, so that you have some of that stuff to start thinking about, share, utilize however you see fit within your programming that you're doing. But as we think about etiquette, it's really important that we're asking questions before we help. So I talked about that earlier, about that presuming competence. So assuming that someone is able to do things for themselves until they tell or show you otherwise. So if you feel like you want to step in and help, make sure you're asking that it's okay to do that before you automatically assume that it is. Because even though something might be a little bit of a struggle for someone, many times they would rather do it themselves and struggle, be uncomfortable, be frustrated, than have someone just automatically do it for them. And again, if we are stepping in and doing it for them, they can't learn that skill on their own if they aren't actually doing it on their own. Another piece of etiquette is to remember not to make assumptions. So don't assume that someone can or can't do something. Don't assume that someone needs support. Don't assume that someone isn't interested in what you're doing because you don't think maybe they have the cognitive ability to do that. Don't assume what someone's project level ability is to do within their project work they're doing. So really, again, let people decide what they can and can't do, and don't make assumptions around what that may or may not look like. Another important piece is to speak directly to the person. So even if, for example, they have a sign language interpreter, your conversation is still with that person, not with the interpreter. So when you're speaking, you're going to want to speak directly to them. The same is true if somebody, anyone who has a disability. So if they have a cognitive disability, you want to have that conversation with that person rather than maybe the support person who's there. And there are times where, yes, there may be some conversations that happen with the support person, but we want to have those conversations directly with the person with the disability whenever possible. And when you're doing that, also to just keep in mind too that people with a disability, even if they have a cognitive level that maybe isn't the same place as their peers, they still hear and see everything that you do. So if you're talking about them to a parent, to a personal care attendant, to a support person, that's really not a practice we want to do. Just as I wouldn't want to be standing there while someone else is talking about me to someone who's with me, someone with a disability also does not want to do that. So, so just remember that. Speak directly to the person, allow them to self-advocate for themselves versus asking the person with them what they like or what they're able to do, or what they want to do. Like ask that person directly if they're able to answer for themselves. Another key piece is to be sensitive about physical contact. So to think about, there are some people that have some stability issues. Make sure that you're not touching them because that may throw their balance off. Some people also, like sensory wise, they don't like to be touched, right? So I think about like my kids, like they'll let me hug them, have that close physical contact. But they're one set of grandparents they don't see super often other than holidays. And when they come up and like hug them and are really in their face, that makes them really uncomfortable, because they don't have that comfort level with them. They also just don't like that physical contact in that way. So just be really conscious of how sensitive some people can be with that, and don't touch people more than you need to. Another key piece is develop relationships. We talked about the importance of that earlier. Sometimes we find that, people with disabilities have a harder time making those relationships and developing those with people. So if you can be that person who can be that close, trusted friend, staff person, whatever it might be with them, try to do that. And again, the stronger relationships you have with them, the more likely that young person or their parents, their support people are going to share with you what they need to be successful. And the more you know about how to make them successful, the easier your job is going to be, because you'll know what to do to help them out. In general, we also want to use person first language. And what that is it's when referring to someone, you would refer to them first and then their disability if you need to refer their disability at all. So rather than saying like, so if somebody with autism, you would say they are a person with autism, right? Versus saying, and this is an autism is one that's a little bit weird. Autism in the deaf community tend to actually prefer disability first language, which disability first language is where you would say like an autistic person, right? Versus a person with autism, or a deaf person versus a person who is deaf. But in general, most people want to use that person first language. So know that that should kind of be your go-to, versus referring to the disability first. But also listen to how they are referring to themselves. So if you hear someone calling themselves an autistic person, refer them in that way, right? And use that same language that they are using when they're doing it. And if you're not sure, ask. Again, people are going to be much happier if you ask versus if you are using language that isn't what they're comfortable with. Another key piece of etiquette is to avoid using the term normal. And I told you we were doing that like exclusion, segregation, that piece that that would be the only time you'll really hear me using that language. And that's really important because by using the term normal, that automatically makes the assumption, creates the environment that anybody who is not normal is abnormal, right? So we want to make sure that we're just never using that language, right? You might use language like neurotypical, to say that someone's like cognitive abilities are typical of their age. But we never use those terms of normal, right? We probably would never say not normal, but we also don't want to use the term of normal, like, oh, they're normal, right? So avoid that terminology whenever you can, because again, it automatically makes the assumption that anybody who is not normal is abnormal. Another key piece is to check enrollment data, and I'm not sure what exactly your enrollment system looks like there in North Dakota, but we have some questions as people enroll online through 4-H Online or even on our paper enrollment forms that ask a little bit about health information, accommodations that they need, those type of pieces. So make sure that you're actually looking at and utilizing that information. People are providing that to us so that we know about it and we can support them in our programs. So make sure you're checking that, make sure that Anyone who's going to be supporting that person and ensuring their success also knows the information that that family wants shared with them. And then another piece, here in Minnesota, we have an accommodation form, which I'll share with you. So if you choose to do something, or you may already have a system in place for doing that, make sure that you are using accommodation forms, making them available for people so that they know that you want to make accommodations, and it provides them a platform or a way to be able to share what they need in order to be successful. So that's some basic disability etiquette that's going to apply to anyone with a disability. Then as we think about things that are just disability specific, if you have someone who's a wheelchair user or has some mobility issues, we kind of talked a little bit about this on the previous slide, but don't lean on or touch that person's wheelchair, cane, crutches, any of those type of things, because for them, it's really an extension of their body. And also, and especially for someone who's a wheelchair user, make sure you're placing yourself at eye level when you're having conversation. That way you're on a level playing field versus you being higher and them being lower and feeling like you're talking down to them in that conversation. So keep that in mind as well. For people who are blind or visually impaired, you always want to identify yourself because they aren't going to be able to see, obviously, who you are. You also want to make sure that if they're using a cane or guide dog, that you're walking on the opposite side of that so that you're not going to be interfering or in the way of that. And then when you're giving any directions, make sure that you're not giving visual directions, which is something that I think we really need to be aware of, because that's how we naturally give directions. So think about, how do you give directions in a way that aren't visually driven? For people who are deaf or hard of hearing, you really want to make sure you're following that person's cues to determine how they prefer to communicate. You want to make sure that you're speaking in a normal tone, using normal facial expressions, body language, gestures, all of those things to help in communicating that message to them. And you also want to make sure you're speaking directly to them rather than interpreter, which I mentioned earlier. Because again, even though there's that interpreter who is signing what you're saying, you're still having that conversation with that person, not the interpreter. So just keep that in mind as you're, thinking about those interactions that you might have with someone. Then as we think about people with speech disabilities, or those kind of like slowed speech, think about giving that person your full attention and allowing them extra time to answer, which can be difficult. Sometimes it can feel awkward to wait. But what I would encourage is, if it's somebody with a speech disability, to give the time you normally give and a little bit more, just because they may need that time to process that. And again, it may feel uncomfortable, but the more you do it, the less uncomfortable you'll feel. And also be patient, right? Know that the way that they communicate might look a little bit different than what you might be used to, but just be adaptable and patient as they speak the best that they're able to. Don't interrupt or finish someone's sentences. So don't assume that you know what they're going to say and fill in the blanks for them because it's taking them longer to get that message out. You might also ask them to write down something if they're able to. So that way you can have them maybe communicate in a way that might be more comfortable for them. Or you might want to suggest or ask them what other ways are that they can communicate. So my oldest daughter has a speech device. So for her, like, that's a really important way for her to communicate. So people who are communicating with her, they would need to be a little bit comfortable in kind of going with the flow with that and communicating in that type of way. As you think about people with developmental disabilities, we want to speak to the person in really clear sentences, using those simple words, concrete concepts, just to reduce any of that potential miscommunication or confusion about what you're saying. You also want to make sure that you're rephrasing what you're saying to provide better clarity. So say things more than once, say them in multiple ways so that hopefully that message can be heard. And you also want to stay focused on the person as they respond to you. And again, be patient, knowing that it may take them a little bit of extra time to process that, and just to wait, and it's okay. So kind of like when we ask, are there any questions, right? And we wait and it feels awkward. Maybe we wait a little bit longer. Same type of thing when you're interacting with those people that might have a developmental or a speech delay. And then finally, for people who have a service animal, make sure that you aren't distracting feeding, petting that animal, because for that person, it's not a pet, right? And we oftentimes may think of a service dog, for example, as a pet. It's really not. It's there for them to be able to be supported so that they can be successful. And then again, respect that handler. So if they, ask you not to touch their animal, to stay away, whatever it might be, make sure that you're doing that too. Because for them, it is a very important part of just their daily living ability that they have. All right, so now we've talked a little bit about what disabilities are, what some of the etiquette is. I want us to talk a little bit about how we know what to do. Like, what do we do in situations? So some of the ways that we know what to do for someone is to ask. People generally are not going to be offended if you ask them what you can do to help them or their young person be successful. They're going to be glad that you asked, because many times people don't ask that question. They make assumptions, or they don't take the extra time and energy that it might take for them to be successful. And they just assume that someone's just going to fit into what they're already doing. And if they don't, oh well, right? So ask what you can do to help them be successful. Frame it in a way that's really about helping their young person be involved, be successful in your program, and help them to understand that you want them there. And you want to make accommodations to help them be in your programming. Another key piece is trial and error. It's important to recognize that everything we try might not work, right? We might think it's going to be a great idea. It's going to help someone to be super successful. And we might find out that it is everything but that. So if that's the case, try something new, keep trying things new until you find what is going to help them be successful. And if you get it right away, awesome, great for you, keep doing that, right? But just know that you may have to be adaptable and try different things to help someone be successful. Another key piece is, be flexible and creative. So think about how can you use what is already in your environment in maybe a different way, to help someone to interact better with what you're doing. Again, developing relationships, that's super, super key for all families in our programs, but especially for people with disabilities, because the better relationships you have with that young person, their family, the more open and honest they're going to be with what they need to be successful. I've had families in the county 4-H programs that I've worked with that have really trusted me. We've had that relationship and they've shared a lot of information with me, sometimes maybe more than I want to have shared, which some of you can probably relate to. But that also allows you to really understand their young person and to be able to find out from them what you can do to help them be successful. Another key piece is to encourage open communication. So make sure that people know that you want their young person in your program, that you are willing to make accommodations. So it's really about, putting that wording out there, having that wording on your websites, on your promotional flyers, registration materials, all of those things, newsletters as you're leading up to showcase or county fair type of events, so that people know that you want all young people in your program and you want all young people to find success. And if that means they're making accommodations, that's what we want to do. So make sure you're having that communication. We in Minnesota have this accommodations request form that you can see on the slide. So with that's on our volunteer resource site so that families can use that, volunteers can share that. We also ask that staff share a link to this, either as like a paper form people can print out and send in, or they can make a copy in Google and fill it out that way. Or I also have it as a Google form. So when I worked locally in a county before county fair or showcase events, I always made sure that multiple weeks, multiple months leading up to those events, I was including a link to this accommodations request form, so that people could share with me what type of things I could do to make them successful. So for county fair entry day, for example, we all know that's a really chaotic day. And it can be even more overwhelming for someone with a sensory disability, especially. So we were able to use this type of form to figure out, how do we do judging at a different location? How do we do judging at a different time, whatever it might be, to help them be successful? And this form, essentially, you can see there at the top is just that basic information about the person who submitted that form. And then there's really two questions we asked. One is about what information would be helpful for us to know, so they can share their fears, needs, likes, dislikes, whatever it might be. And then those pieces of information would get shared with volunteers, livestock show, superintendents, judges, other staff, whoever needed to know those pieces. Anybody who really had a key role in ensuring success, that information was shared with. And then they were also able to share what accommodations that they're requesting. So, did they want a judging time that was earlier than when everybody else is going to be in the 4-H building? Did they need to do a separate judging for their animals at the pens in the barn, or whatever that might look like? It gave us that information to be able to do that. Or even, for a livestock show, it might be that they needed to have a support person in the ring with them to help them keep control of their animals. So they were able to provide that information for us here, and then we could share that out, because sometimes families, rather than having to always ask for the same thing from 10 different people, so from your judge, from your show volunteers, your livestock superintendents, it was easier for them to make the one request, and then we could make sure that everybody who needed to know was able to help them be successful. And then another example is a one-page description, which I'll show you in the next slides, but that's really an opportunity for someone to share a little bit around what they need to be successful from really a personal perspective. And then a final one may be enrollment information, depending upon what type of enrollment information your state collects there on your 4-Hers. So those are some ways to kind of get ideas of what to do and what accommodations someone might need. As I mentioned, I'll talk through this one-page description a little bit for you, and I'll show you an example on the next slide. But really, a one-page description is a way for us to gather information about what's important to someone and then how they need to be supported. It can also be used as an introduction to someone. So we've used this with some of our 4-H clubs, and we have introduced it with our volunteers across the state as a way to do introductions in your clubs, either as everyone in your club does it for your whole group, depending upon the size of your club, or it might be done in small groups. And you'll see on the next slide what I mean by it being used as an introduction to someone. The reasons you might want to use a one-page description is it allows for person-centered planning. So someone can just personally share what they want, and we can individually base it on what they need. It also is an opportunity for people to get to know each other a little better. It can also be used for someone to express their needs, their desires. People are also many times more open and willing to share in this way than they might on enrollment data that they maybe are a little bit uncomfortable about sharing widely with people. People also with a one-page description can share the information themselves or with assistance versus if it's coming through an enrollment data versus a parent sharing on their behalf. And it also allows for some more relevant information that maybe isn't encompassed in some of the questions that we asked for enrollment data. Some of the ways we've used it here in Minnesota is we've used it as part of retreats, meetings, trainings, those type of things. So let me show you what that looks like. And let's see, there's a question in the chat. So how do you make the accommodation requests be available county to state or county to county? Great question. So we actually recently added a field to 4-H Online in some of like our staff fields where we might enter some of the other like internal data that isn't available to just people randomly. So we've got it there where staff can put a summary of the accommodations requests that are coming in. So that way, if somebody signs up for state fair or regional leadership activity, whatever that might be, they can go in and they can print a report out of 4-H Online that will show all of the accommodation request information that has been entered for them. And again, like I said, you can see it, the way that it's set up for our county staff, they can only see enrollment data for their county. Regional staff or state staff can see it for the whole state. So depending upon what type of programming you have, It might be a matter of county staff being able to access it or regional or state staff accessing it for them and sending a report to them with that information. Good question. All right, on the screen, here's an example of one-page description. This is a really generic version. This is me on there. And there are 4 questions on there. What's important to me? So that gives people an opportunity to share what they need to feel valued, what they need to feel like they're part of the group. There's a question around what people like or admire about me, so that we often tend to not spend very much time sharing what we're good at. So this is a place for us to list what other people might recognize as being strengths for us. Another place is how can you best support me? So this is a great place to see accommodation ideas come out for someone. And then what do you want to learn about? That's a great place that you can take some of that information to plan project workshops, field trips, guest speakers, demonstrations, whatever it might be. And this, like I said, is a really generic version, which I'll share with you an activity plan for this that concludes the blank sheet. But you can also change these questions in the bubbles to whatever you're doing. So if it's showing livestock, you could change these questions around, what support do you need in the show ring? What's important for you to achieve out of your livestock show experience, so on and so forth. So you can edit this based on any and all activities that you might have going on. So. All right, I also want to share with you a mentorship guide. This is a tool that we created, myself and another staff from Anoka County, which is one of our metro counties. And this mentorship guide was developed to really help support families with youth with disabilities. And it includes general information, but it also has some information specific to people who might be a project mentor. So we wanted this to be applicable for both mentors within our 4-H community clubs, but also like a horse project mentor or a shooting sports project mentor, whatever that might look like. You can see there from the image, it includes some general information about mentoring. It has role descriptions for the mentor and the mentee, as well as a project mentor. It has a conversation guide that really helps them and lays out some different things to talk about on that monthly basis based on the time of year and based on the activities that typically would happen during the 4-H year. There's also some mentor resources in there. So some links and resources of things that might be useful for a mentor to share with a mentee. And then there's also a year-end and evaluation for both the mentor and mentee so that we can determine how successful that experience might have been. I'm not going to go through it a ton just because of time, but just know that's a tool that I'll share that's available to you as well. All right. Okay, and then another key piece of information I want to share with you is called the Incredible 5-Point Scale. And this, I was thinking there were some bullets on there. Okay. So this Incredible 5-Point Scale is a research evidence-based tool that was originally created for people with autism, but really has a lot of applicability across any type of person, regardless of whether or not you have a disability. And with this can be used as a way to check in as someone is coming into your program, can be used to check understanding, can be used to check anxiety levels if you're kind of pushing someone to learn something new that might be a little bit frustrating and different and struggling for them. So a lot of different ways that you can use this, and it can be designed as numbers, colors, whatever type of way you want to do it. This is just the generic 5-point scale. And with that, you can see that that green means like someone's calm, relaxed. And as you move up the scale to the 5, eventually that red, that means that somebody's ready to explode. So really it's a way to share with an understanding with the group and in terms that as you incorporate this, that is a shared understanding that everyone understands. And like I said, you can use it as someone's coming into an after-school program, right? To really gauge how was their school day? How are you in being ready to learn here with us for our 4-H activity? You could use it at the conclusion of static or your judging day for your 4-H projects, right? To gauge that anxiety level that happened maybe throughout the course of that judging experience with someone. You can use it at a project workshop to gauge, like the learning that happened. throughout the course of that time there. So that's what that looks like. And is really developed as a social emotional regulation tool, and really a self-awareness tool, but it has a lot of applicability in different ways that you can use that within your program, just to build, again, that shared understanding of where people are at and where they're engaging with your program. And I'll share this with you, as well as a little bit more information if this is interesting to you to look at and think about how you could use in your program. All right, with that, we are going to wrap things up, and actually really good timing, so that's awesome. But I just want to also give the opportunity for you to ask any questions that you might have. And we'll kind of talk through those pieces, and I'll stay on as long as all of you want to stay on for questions. Otherwise, I hope that you will join us for the rest of this series of trainings, so you can hear more about how to better support young people with disabilities in your 4-H programs. Oh, and you've got a comment about Leanne, learning from Todd here in Minnesota, how to do that in 4-H online. Absolutely. Yep. And that's something that we are just rolling out here. We've used the accommodation request form, either as Google form or like a paper form that people could print for a little while. But we're really now just rolling out here in Minnesota, actually here in January, using that field as we're leading into some of our like regional youth leadership opportunities that we have, so that people can know what that accommodations request information is and not have to make the same accommodation request over and over, whether it's a state fair or a regional leadership event or a county fair or whatever it might be. So yeah, we can definitely connect them and see if we can figure out how to incorporate that into what you're doing here in North Dakota. All right, with that, I will be quiet and I will let you guys ask questions.
And feel free to unmic, because I have a couple questions, but I know you guys might also, so. Maybe I'll kick off if nobody wants to. So what if, and I'm talking about scenario based probably, because I've personally ran into, what if a parent is maybe, really just finding out that potentially their child has something, and they're embarrassed, or maybe they're in that emotional stage of just frustration and they don't feel comfortable even acknowledging that they need to fill out a form, and they're maybe just really frustrated at this point in time, and so they really aren't willing to provide any guidance or helpful tools to help with their youth or their children. Have you ever had to navigate that?
Yeah. Yes. And I think all of us probably, and I'm going to stop sharing so I can actually see you guys talking versus you seeing my slide there. But yeah, I think all of us at one point or another are going to experience that in our 4-H program, of either someone who is just kind of getting that diagnosis or has those suspicions, or someone who has a diagnosis but doesn't want to share with us because they don't want to acknowledge or maybe accept that their kid has a disability, or their kid isn't maybe what they thought or expected it was going to look like. So I think in those situations where we don't have someone telling us, okay, this young person has a disability, here's some things to try, then I think we just need to, as youth development professionals, make our best judgment and guesses of what we can do to help them be successful. So if we're seeing that somebody is really having a hard time sticking with us through activities, maybe we need to put some strategies in place, and we'll talk about this like in our next one about accommodations, that will help to help that person stay on track a little bit better, as well as the rest of the group for that fact to do that. So I think we just need to, as professionals, use our best judgment of suspecting that maybe somebody has a disability, and putting some accommodations and support practices into place that will help them be successful. And as you mentioned, like when someone receives a diagnosis, it can be really frustrating, really upsetting. They actually like equate it to the same type of loss that someone experiences when they lose a loved one. And the reason that and there's like 7 stages that they go through. And one of those is grief. And the reason that they go through that is because the idea of who that person was going to be and what they were going to experience, there is a sense of loss that comes with getting that diagnosis and knowing that my child may not experience those things that I expected for them in life, right? And my relationship with them may not ever be what I expected it to be, because of what goes along with their disability. So just know that there definitely is a process that goes with that. And some families, even when they've gone through that whole thing, they will never share with us about their young person's disability. I've had parents who will outright tell me, like, I won't put it on enrollment information. I won't fill anything out because I'm afraid that that information, like, other people will find out outside of 4-H, and that will have lifelong impacts for them. So in those situations where they won't disclose, we just have to use our best judgment and put in place practices that we think might be successful.
That's helpful. Thank you.
Other questions? And I know I gave you a lot of information in an hour, so you're probably feeling overwhelmed right now, but I will share all of the slides with you so that you have those pieces, like I said, as well as some links to some pieces. And then we'll just keep building on everything in this series for you.
Awesome. Thank you so much. And I'm excited that you guys are just now putting that 4-H component, because I like how Lynette was like, well, you know, it would be nice for the family not to have to fill that out for every single event and it just be in 4-H online and can be downloaded. Like, what a brilliant idea.
Yes. Yeah. And that's where we wanted to do it. Cause yeah, otherwise, or you might assume as a family that if I filled it out one time for my county, that information is shared with everyone else. Well, it's not, right? At least it hasn't been.
No.
You know, so then you get to an event and you don't have the support things that you need, and you go, well, why? I've shared this, right? So yeah, so it'll actually be, we send like a monthly or weekly newsletter every Monday. So it'll be in the week, like 2 weeks from today. So the week after Martin Luther King is where like they'll go out to staff to see like, okay, there's this new field. But yeah, I mean, our Todd can definitely like share with you the user guides, because we also incorporate it into a question in Fair Entry. I don't know if you use Fair Entry for your fair registration process, but we incorporate in there. We've also asked people to incorporate on like their registration forms when they're doing it through 4-H online, like event registration. So that is just automatically there too for people to be able to share.
That's pretty cool. Awesome. Well, thank you so much for our first session, and we're excited to see you next month on our second session.
Awesome. And if anybody has questions, in the meantime, definitely reach out. Happy to talk through questions, scenarios, situations, all of those things in the meantime. Otherwise, we'll talk accommodations next time.
Thanks, Darcy.
Yeah, thank you.